Some 400,000 Mainers rely on Medicaid for health care. And when looking at the number of people covered by Medicaid nationwide, that number jumps to at least 80 million.
Congressional committees that oversee Medicaid and Medicare have been given a directive now to make $880 billion in cuts to either of those health care programs.
As News Center Maine's Raya Wooten tells us, healthcare professionals are on edge, and some organizations that advocate for cancer patients believe people battling various cancers will be gravely impacted.
Our elders rely on Medicare, and our people who are under 138% of the poverty level and who have disabilities rely on Medicaid.
After the recent congressional budget resolution passed last week, healthcare professionals like Katie Fulham Harris from Maine Health fears big-ticket items like Medicaid are at risk of being cut.
What does an $880 billion cut to Medicaid or Medicare look like to healthcare systems all over?
$880 billion means that we're going to see a significant reduction in services, in eligibility for care. About a third of Maine's budget is Medicaid. The state can't make up the difference.
It wouldn't just rip health care coverage away from some 80 million people nationwide. Representatives from American Cancer Society Cancer Action Network say they're particularly worried for a certain segment of Americans who fall under that umbrella.
Cancer patients who are on Medicaid would struggle with access to care.
It would also disproportionately affect people with cancer.
Lack of access to preventative care, especially screening, which is key to preventing cancer, and early diagnosis, which is a key determinant in survival. Those are the type of effects that cancer patients would be seeing.
Research from American Cancer Society shows that 1 in every 10 adults with a history of cancer relied on Medicaid for their health care in 2023. That's the same year that Bethany Zale, who dedicated her life to breast cancer advocacy, discovered just how critical Medicaid can be for people battling cancer.
And then after doing that work for a decade, in 2023, I was diagnosed with stage 2A breast cancer.
Medicaid was the only health care that Zale had access to when she was diagnosed with breast cancer. For years, her cancer treatment and care has been fully covered by the Breast and Cervical Health Program, a program funded by Medicaid and one that Senator Susan Collins heavily supports. In a statement, Collins says making cuts to Medicaid is the last thing she wants to see happen. But now that the budget resolution has passed, funding for Zale's care is a toss-up.
In 6 months, I'm going to be having my breast MRI. That appointment is already scheduled. And when I heard about these funding cuts, I was, worried, will that appointment be covered in 6 months? I don't know.
Raya Wooten, News Center, Maine.